The U.S. Army says it will immediately begin discharging soldiers who refuse to get the mandatory COVID-19 vaccine, putting more than 3,300 service members at risk of being forced out. Roughly 97% of all soldiers have gotten at least one shot. At the same time, Defense Secretary Lloyd Austin has informed 7 Republican governors their state's National Guard members must be vaccinated against COVID-19 amid an ongoing dispute between GOP leaders and the Pentagon over that mandate. Pentagon Press Secretary John Kirby responding right here on MSNBC.
We are rock solid and convinced that the Secretary has the legal authority to mandate these vaccines. Mandatory vaccines are nothing new in the military. We've been doing it since George Washington at Valley Forge. This mandate is absolutely solid in terms of our authorities, and we're going to continue to pursue a mandatory vaccine regimen for the rest of the force.
Well, meantime, on Capitol Hill, Senate Minority Leader Mitch McConnell is calling for an end to the COVID-19 state of emergency.
It's time we accept that COVID is here to stay, and we just need to get on with our lives. It's time for the state of emergency to wind down.
Joining us now, NBC's Molly Hunter, live in London, and Dr. Amesh Adalja is with the Johns Hopkins Center for Health Security. Good to have both of you here. Molly, I know you just got back from a rare interview with the 2 founders of BioNTech in Germany. That's, of course, where the Pfizer-BioNTech vaccine was created. What's the headline?
Hey, Chris, that's right. Look, first, pretty incredible to meet them. It was an opportunity to say thank you, but we had a couple big questions going in. So we asked them, of course, about the pending FDA approval for those 2 doses for kids. They said they were excited about the 2 doses. They said they will definitely need a 3rd dose coming down the pipeline for that more complete coverage, just like the adult dosage. We also asked them, Chris, about variant-specific vaccines. So we asked them how quickly they could actually turn a new vaccine around after the detection of a new variant. Take a listen.
We are now prepared. I think we understand how this virus operates. We will see also in future escape variants, and we will be able to adapt our vaccine. What is important is that vaccinated people are protected against severe disease.
But so how quickly do you think you'll be able to turn it around?
It really depends on the regulatory authority to be defined path. As Uwe has pointed out, technically we are able to do this within 3 months, and whatever authorities want to see on top in terms of clinical data, for example, needs that extra time. And so it's not under our control exactly how long this takes.
And 3 months is already a magic time, so you can't go much shorter.
Chris, magic time is what they said. And these are 2 people who have been very good at doing things in record time over the last 2 years, of course. I asked him if even for Omicron, if 3 months was going to be too late for much of the world. And he said even though many countries have already had their Omicron peak, actually 50 to 60% of the world will still be Omicron negative by the possible authorization of this variant vaccine in April. He also said people who got Omicron infections early would also benefit from this. But basically, the speed that these 2 scientists are working is unbelievably good news for all of us as we look forward to getting back to the office and getting back to some sort of normalcy. Chris?
Yeah, I think a lot of us, Dr. Adalja, continue to be in awe of how quickly we were able to respond with vaccines. And you know, we're seeing it here. But I also do think that the question gets raised about the timeline. I mean, you know, Omicron just moved so quickly, certainly through the United States. Yes, there are lots of parts of the world where maybe it hasn't hit yet, but are those parts of the world where they've even started vaccinating? I don't know. Is this something that in the long run we're going to be able to keep up with? These variations?
I do think we have. I think we have to think about what the optimal vaccine policy is going to be. Is this going to be something where we update strain changes the way we do with flu, or is this going to be something where we're satisfied with protection against serious illness, hospitalization, and death? And I think that's going to sort of dictate what we do. But it's always, when you're trying to guess what strains are going to be coming up, just like with flu, it's a guessing game, and you're always going to be in a reactive stance, not proactive. So that's why I think that the better solution might be universal coronavirus vaccines, ones that target parts of the virus that don't don't mutate, and not just for SARS-CoV-2, but for all of the other coronaviruses. And there are companies that are working on this. Walter Reed is working on this, and they are moving into clinical trials. So ultimately, hopefully, a universal coronavirus will be the way that we tackle this problem and don't have to get into this game of guessing.
You know, the numbers are still quite staggering here in the U.S. The average daily death toll, is more than 2,600, higher than last fall's peak. Deaths overall up 36% from 2 weeks ago. And to put it in some context, when you look at European countries, other wealthy countries, it's higher than it is there. Yet there are people continuing to say, and we heard this yesterday from Minority Leader Mitch McConnell, it's time just to move on. I know we've talked about this before, but do we have to get past it? Have we given up trying to get past it? What's your view on where we are and how we should be looking at this right now?
It's a very difficult situation because what we're seeing with these high death tolls is that they're all self-inflicted. These are primarily people who are not vaccinated, who have chosen to put themselves at risk and to compromise their hospital's capacity. And that's very different than someone who's fully vaccinated or high-risk people that are boosted, where for them, COVID-19 is a much more manageable infection, one that's not going to land them in the hospital or even cause them to call the doctor. So I do think we have to think about how we transition to treating COVID-19 like other respiratory viruses. The key thing, though, is that we still have these hospitals that are worried about capacity. We still have too high of a death toll for this to be truly thought of as an endemic disease. I think we're going to get there as we get more tools like Paxlovid, the antiviral from Pfizer, more monoclonal antibodies, more rapid tests. We are transitioning, and maybe after this Omicron surge, we will be at that point. But the key thing right now is to really not forget that there are hospitals that are still struggling with patients that are unvaccinated, and that's the biggest challenge that we have to putting this completely behind us. But I do think we have to think about a sustainable approach where we're not in a continual state of emergency.
Dr. Adalja, Molly Hunter, thanks to both of you.